Hi, everyone, and welcome. So we're so glad you're here today. My name is Dr. Annie Rutter, and we are excited to join you for our virtual discussion this evening, a conversation with faculty and advisors guiding students through the Family Med Match. My name is, as I mentioned, Dr. Annie Rutter, and I'm the chair of the Medical Student Education Committee for STFM. And in my day job, I'm the director of medical student education at Albany Medical College in upstate New York, and I have been advising medical students for the match for over 10 years, which is hard to believe. Today's webinar is a joint effort by STFM and AAFP to support advisors as they guide students through the FM match process from application to interview to rank list submission. And I'm so excited that you're all here today and we're having this discussion, as the process and the approach to the match has certainly changed over time for the students and therefore for the advisors. And I know I'm biased, but one of the most significant roles an undergraduate medical education faculty can play is one of advisor. And so for senior students entering residencies in family medicine, having an advisor that's well-versed in the challenges and the intricacies of the match as they relate to family medicine is of vital importance. And as I alluded to, the complexities of this process have increased over the years. It's with the seemingly ever increasing number of applications students are submitting, also known as application fever, to the new and possibly continual virtual interview process, as well as the transition of USMLE Step 1 to pass-fail. Advisors have a lot to keep track of as they seek to provide the best guidance to their students. So we're hopeful that our panel today will lead a discussion with all of you advisors from across the country to see what resources are needed to support advisors and to help all of us increase our understanding of the match process and to think through these various challenges. And so with that, I would like to have our panelists each introduce themselves, and we will start with Dr. Angie Wagner.
Hi, I'm Dr. Angie Wagner, and I am at Marian University College of Osteopathic Medicine, and I am an assistant professor in family practice and osteopathic principles in practice. And I have been advising students formally as a medical educator for 4 years and informally for about 5 or 6 years. So.
Excellent. Thank you for joining us tonight. Dr. Tomoko Sairenji.
Hello, thanks for the intro, Annie. I'm at the University of Washington School of Medicine in Seattle, Washington. In my day job, a lot of my work is related to advising. I direct our advising program within our Department of Family Medicine. Unfortunately, we have a lot of students interested in family medicine, so we end up talking to about between 55 and 70 students. Not everybody ends up matching in family medicine, however. So I've been doing advising for about 6 years now. And I think being in Washington, we also have a little bit of a unique situation of whammy. So if there's any questions about that area, I can also help address that. Thank you.
Excellent. Dr. Jennifer Edwards-Johnson.
Thank you for the introduction. I am Jennifer Edwards-Johnson. I am at Michigan State University College of Human Medicine. In my role of community assistant dean of our Flint campus, I advise students and have been doing that for about 2.5 years. And I'd say informally have been advising students, particularly in the area of family medicine, for about 4 to 5 years, both sort of informally and formally.
Excellent. And Dr. Melissa Johnson.
Thank you for the introduction. I'm Melissa Johnson, and I am from the University of Colorado School of Medicine. I'm an assistant professor there and work on our undergraduate medical education team and work with both 4th year and 1st year medical students and some of my other teaching positions through that, and have been directly advising our medical students interested in family medicine for the last 3 years as part of our core family medicine advising team, which at this time there are 10 of us in family medicine, which is pretty neat. So excited to be here tonight.
Excellent. So I'm glad you're all here with us. And, we put this panel together with an effort to sort of look at different areas of the country, private and public medical schools, osteopathic schools and allopathic schools, and really trying to get a sense of what advising looks like across the country. And so with that, why don't we start with just talking a little bit about the advising programs that you have currently in place at your school. And so I'll start. So here in Albany in upstate New York, we have each of our students at the medical school have an advising dean who is not specialty specific. And so every student has their advising dean. And then students who are interested in family medicine actually find their way to our offices through their advising dean. So they technically sort of get referred to us for conversations around planning for the match and for career advising. And then it's through our FMIG actually that we do quite a few workshops and group sessions. Last night we did our mock interviews. We have a CV workshop. We do an intro to fourth year planning and timeline, and it's all sponsored by our family medicine interest group. And so that's a group of faculty that are part of that who do some group advising, and then individual advising comes sort of depending on mentorship relationships, but we don't have assigned individual family medicine mentors for students. And fortunately this year, we usually match from Albany Med anywhere between 10 to maybe upwards of 15 or 16% of the class into family medicine. So it's variable, but that's where we're crossing our fingers for 15% this year. So that's what we'll see. So Tomoko, why don't you tell us a little bit about the structure at University of Washington?
Sure. So our advising, so we have our family medicine advising team. So it's a little bit complicated because University of Washington has 6 campuses across the 5 WAMI states, but we consolidate our advising and mostly conduct it out of Seattle. The advising team is actually very small. It's just me, one other faculty member, and an administrator. And so one of the 2 of us, the faculty members, will talk to every single student who's interested in family medicine. There's multiple ways to engage and kind of get referred to speak with a family medicine advisor. Or one is if, through the family medicine interest group, we also have several advising events that are affiliated with FMIG. If somebody signs up for Sabai in family medicine, then we have a listserv for advising. So in 3rd year, if you sign up for a family medicine Sabai, then you automatically get enrolled in our advising listserv, and we send out information through that. And then we have our School of Medicine advising team, and they oftentimes will send referrals. And so we work pretty closely with them. Students can also self-refer by filling out a form on our advising website. So and that's really helpful to sort of streamline the process. We collect sort of basic information through that form, what they want to talk about. And so we used to spend an hour with each student, but then realized that is not, with the numbers increasing that in our school applicants, and it just became too much. So the form actually helped us make our visits 30 minutes each, which is much more manageable.
Excellent. And so the other thing I want to mention, and I should have said this in the introduction, for all of the attendees, there's a chat function. If you'd like to send a question through the chat, please feel free to do so. And then when we get to a little bit more of the discussion part of the panel tonight, then we will actually be able to have you unmute and turn on your camera if you want to be able to join in on the conversation. So Jen, why don't you tell us a little bit about the structure of advising where you're at in Michigan?
Absolutely. So at MSU, we're kind of similar. We're a community-based College of Human Medicine. And so we have multiple campuses, and each campus has a community assistant dean. And in each campus, that dean does a lot along with their counterpart or student programs administrators to talk with each student about their career interests and eventually the specialty that they're going into. We do that a lot in conjunction with our assistant dean of student career and professional development. And that person really does a great job at looking at the data and helping students think about how many residencies they should be applying to geographically, how that might be complicating their application, things like couples matching or things of that nature. So when things get a little bit more complicated, we're working a little bit more closely with our assistant dean. But a lot of it's that one-on-one that we do on the campuses. And then we do a lot with mentoring. We definitely try to link our students with mentors in the area. It helps that we're pretty well represented in family medicine at our college. Our assistant dean is a family doc, as am I. And so we get a lot of good representation, but there's a lot of opportunity for sort of that one-on-one mentoring and advising.
Great, thank you. So Melissa, tell us about Colorado.
Great, thanks. So we do have a formal advising program that typically starts out with outreach in the first and second year for students. And similarly to some of the other groups, we utilize our FMIG involvement in some of the events to kind of catch some of those students that may have early interest in family medicine. Our undergraduate medical education team in the Department of Family Medicine is actually quite large. And so we've been able to leverage that to utilize some of those people that are paid for other activities to then also be a primary advisor for family medicine, even though it doesn't technically fall under their position title. And so that's one of the ways we're able to have 10 faculty advisors for our family medicine students. And so a lot of us will have other roles within the first and second year of training for students. And so as a way that sometimes we'll have other mentorship opportunities and find students that way that are then interested. We then create a spreadsheet of students that we think are interested or maybe have put out feelers that they might be interested in family medicine, and we keep emails out to them throughout the years. And towards that December of their third year for those students that are, we kind of send out an email blast, and anybody who's thinking about doing sub-Is, we make sure they have a family medicine specific advisor at that time. Whoever their advisor is also, this year we've switched to having their advisor also do their pre-AI meetings prior to those AIs, because before we had one person doing all of them, and similar to some of the other folks, those are time intensive meetings, so hard for one person to get all of them done for all the students. So we have one specific meeting as the advisor with the student, at least in the beginning, that we have a specific form for, that we talk about what their interests are, what, where their strengths are, maybe where some of their struggles are on their application, so that we can best help them throughout the planning of their fourth year and throughout interview season. And then we also meet with them prior to that first AI and make sure that they've got their AIs within courses for the fourth year where they need them to be. And then we also have a dinner series that starts with at the end of, or at the beginning of their fourth year, while the outgoing fourth years are leaving, we have one dinner so that they get to talk with and get some of the feedback from their peers that have just been through the process before they leave. And then we have a different dinner later on about ERAS, another one about ranking and interviewing. And I think that's pretty helpful as well. We do also offer like letter of recommendation, information sessions, as well as personal statement review through the advising series and things like that. So that's kind of what ours looks like.
Great. And Angie, a little bit about what's happening with you all.
All right, so the challenge is to try to keep it brief, because I have a lot of great things to say about what we're doing at Michigan. I'm from Michigan State, so Jen's got me thinking about Michigan State at Marian University. So I've been around really since the inception, even though I haven't been working there. And we've been very fortunate to have a full-time director of graduate medical education who came from a larger academic institution and has been a wealth of resource for our students and has picked up the reins to learn the nuances of being an osteopathic medical school. And so one of the things I think that we do that makes a huge difference and has resulted in pretty good match rates, especially in primary care and family medicine, is a longitudinal process where from the very beginning in development days, even in their first and second year, already starting to plant the seeds of understanding and have resources available for that career exploration. And into third and fourth year, where it really becomes a very focused part of what we do in what we call our summer, we call it colloquium, and they spend a month with us readying themselves for their third year of medical school. And then the fourth years actually come back, and the majority of that month that we have with them on campus is about preparing for the match and getting their all their pieces in place. As far as an advising process, we have 150 to 160 incoming medical students, typically 150 is our cap. And depending on how many people have had leave of absences. So really between 150 and 160. And we have those longitudinal relationships, a relatively small faculty, but I think it's a really close-knit community, and those students build relationships with us very closely throughout those first 2 years and into third and fourth year. They return monthly for development days, where a good portion of that is devoted to getting those facts and getting those things in place that our director, Chris Parr, who I don't want to speak too highly of because I don't want him to ever leave Marian. So I don't want a little secret that we have, but he's wonderful, and he has lots of resources and spreadsheets and really kind of knows these students inside and out along with us, and a growing list of people that have devoted themselves to really understanding the GME process and building relationships with students very early so that we can help them along the process and discernment about what the right specialty is for them. Just invested in careers in medicine, just getting to know that program, very large amount of information for the students to kind of digest, but it's going to be very helpful to present that to them starting in first year. We just started doing that in December to really help them pick the right specialty and know what they're getting themselves into from the very beginning. From a family practice standpoint, I've shared family practice for about 3 years, so I'm pretty proud of what we do as an osteopathic profession and selecting our students for people that want to be in primary care. Of course, they sometimes change their minds and go into other more specialized areas of medicine, but I'm proud to say that we match anywhere from 25 to over 30% in family practice over the past 4 years, and 54% this last year in primary care specialties. And I'm always willing to help students figure out family medicine versus peds versus IM, and even some of the specialties, really helping them to see. I'm fortunate to have had a very niched out experience in family med, so I can help them kind of see all those opportunities to do things they want to do in family med. So I think the key is just that longitudinal process. And one other quick thing I want to mention is our match. It's not just about getting them to the application process, but walking them through the interview season, and most importantly, SOAP. And we all have students that have to SOAP. We've been fortunate to have really good match rates, a little bit challenging last year, like everyone else. Proud to say in 2020, we ended up with 100% match rate after SOAP. And that was our first year of the combined residency season with ACGME. So I think that close relationship into SOAP has been ideal. We have dedicated space where they can work with us one-on-one in the building and have like almost their own little office where they can work from and have our constant support if they want it. And most of them have built those relationships. They call us immediately when they don't match, and they're on campus within an hour, and we're working closely with them. So I think if people aren't already doing that, I have been incredibly impressed with what Chris Parr has put together as far as how we respond to those students and our whole student services team, and how we are able to walk them through that process and help them get through that very challenging, stressful time. And I'll stop there because I could keep going.
No, that's great. This is great. So I think what's really great for those who are tuning into the webinar is to hear that there's a lot of ways to advise students. There's a lot of ways to build relationships. I mean, Melissa, and Angie really talking, and all of you guys talking about developing relationships early on. I mean, that gets at pipeline, that gets at family medicine recruitment. I mean, all these things that are super important to us. But one of the things I really want to focus on with this webinar, now that we have some background, and for those of you listening, I hope that if you don't have a formal advising structure at your school in family medicine, you start thinking about what resources you do have to leverage to start to build that for your students. But then let's talk a little bit about how we develop our faculty to be prepared to kind of help with this. But then also let's get into some of the nitty gritty. So I'm going to ask the hard questions while we're here today. So one of the things that always comes up when we work with students, they say, how many programs should I apply to? So Tomoko, I'd love for you to take that question and share a little bit of information with us, because that is not an easy question to answer.
Yeah, I think that this is true. And I think it's hard to give clear numbers because people kind of latch onto that and don't, then they don't hear the extra pieces that you want to say, about, think about the program like variety, and make sure that they're not super competitive programs, or all the things that come into a decision of how many programs. So, but that being said, what I found really helpful for me is to use some of the data that's available on match it in family medicine in general. Let me see. So I wanted to share this. So this is from an RMP, the probability of matching in family medicine. This is specific to family medicine. And basically, the bottom shows the number of programs that are ranked and then the probability of matching. And, you can see that the probability of matching is extremely high if one has, applied to even, around 9, 10 programs and so for us, we tell students that if you're an average student, and then we go on to define what we think average is, but then we usually advise applying to 12 to 15 programs and then interviewing at 10 to 12, ranking 10. So I would love to say more, but I'm gonna try not to because this is how it goes.
Yeah. Anyone else have any thoughts on what they asked, how they answered this question? How many programs?
I can add to that.
I just want to echo what Tomoko said. We use that as well. Oh, can you hear me?
Yeah, Melissa, go ahead. Yep.
Oh, go ahead, Melissa. You go, Melissa.
Okay, sorry about that. Our numbers are pretty similar. We usually recommend ranking anywhere from 12 to 15. For most students, what we also did was we created a kind of a list of scenarios and a general advising packet that goes out. And so it starts with kind of a student that doesn't have any potential struggles on their application. And then it goes into potentially someone who had failed step 1 a time or had a low score on step 1 and what your score might have been on step 2 versus people who are couples matching versus the applicant that's geographically restricted. And we talk a little bit about, okay, well then how does that really impact how many programs you need to apply to be able to have the chance to rank close to that 12 to 15. And so we give them different ranges, but usually say to apply to anywhere from 12 to 20 if you're in that kind of average risk student and don't have any of those other risk factors, and then still recommending the 12 to 15 rank. And that so far has seemed to be pretty successful.
I just say our program is very similar, and I appreciate that individualized approach because it's not the same for everyone. I think having a good sort of baseline of what you should do is important, but I agree our students will sometimes latch on to what they've heard, and we do try to emphasize the idea of, okay, well, what is your specific situation? Some of those factors that Melissa referred to, as well as, and I think you mentioned it, geographic limitations. Are you couples matching? Do you are you wanting to be at a program that might have a specific fellowship after, right? So those are all things that we're sort of thinking about when we're saying in that 12 to 20 range, but we're really close to that.
And I would say, what happens oftentimes is that their students automatically inflate that by 5 or so. So when I advise them, and we also always, individually advise students on top of getting, we first give them that recommendation and then individually look at each student separately. But I tell students that I'm already being very safe for you. I would never give you advice that would put you in a position that you are not safe. So I try to reassure them. Otherwise, I know that at the end of the day, they apply to even more, and every year at the end of the year, we have a debrief session and students invariably say that they just applied to too many programs. And yeah, I don't know how to stop that from happening.
I think the only...
Go ahead, Jen.
The only thing I was going to say is that our students will often mention, right, that it is not necessarily free to apply. You get a certain amount, but there's a real cost here, right? And I think that idea of being really thoughtful about the number that you're applying to makes a lot of sense. And sometimes we'll bring that up depending on a student's situation, but I think it's important to think about.
The other thing that's really helpful with this is sharing with students. Oh, go ahead, Angie. I think your internet's a little delayed, but go ahead.
That's okay. Yep. That's all right. Sorry, this is our internet situations that we're in these days, COVID. And that being COVID, that we're still going to be in a virtual interview situation. And I think that allows students in some good ways to throw out a much larger net of programs they never would have done just because of logistics of getting off their rotations to go to interviews and financial costs of travel. So I think that's another factor that's been good in some ways because they've had opportunities that, I had one student who matched family med in Alaska and I never would have had that opportunity probably if he didn't have the opportunity to do this all virtually as well. And it's his dream. So there's some good things that have come from being able to do that, but also that just increases that risk of overloading their options and doing that, but they're making up the cost some and not having to travel for interviews.
Yeah, I think that's definitely true. You know, we see the ease of application and the ease of travel has changed this a little bit too. We'll have more numbers, you know, in the coming years as the virtual interviews, like we said, are likely here, at least in some form, to stay post-COVID. I put a couple of links in the chat. Those links are to the information that Tomoko sent. There's separate reports for MD and DO schools, although the numbers for family medicine are quite similar between the two. So I think it's interesting to look at. These reports are very comprehensive. They include a lot of information for other specialties as well, but you can really drill down. And when you start looking at the probability of match being very approaching 1 at, you know, just 10 programs, it really can help you ease students' minds about, you know, are you looking at 40 to 50 programs? No, you're really not. And really, I think this is where that family medicine specific advising is so important, because our colleagues who are advising students in internal medicine, who are advising students in plastic surgery, the game is different, you know? And so to be really thoughtful about family medicine advising and getting into a family medicine residency is a lot more about fit. It's a lot more about what you want out of a residency than it is like, how many applications can I put out to find a spot? Right? It's different than that. And I think we're really lucky in that way. And so it's an important thing to think about. So we still have a hand that went up. So Emily, if you want to maybe unmute and I think it's Kuram, if you want to share your video or can join us if my guess is your question is related to this.
Yes, thank you. Thank you. So just to build upon the conversation that you just, and as Annie, as your last comment, based on the ease of the travel or no travel and ease of the application. So since we don't have recent data from this pandemic year, would you consider, like, you know, readjusting your numbers of application and interviews to this pandemic related ease of the interview and changing the number of interviews that they may be called in? So that's one. And the second thing, are you in your programs inviting any potential applicants for a second look? Because locally we see some of the programs are contemplating doing that, maybe still sticking to the initial interviews virtual, but maybe doing some sort of a second look type of thing. So I would like to hear your thoughts on that. Thank you.
Thanks, Karam. We're glad you're here with us. So I think there's a couple of things, and one of the things I'll answer is I'm trying not to change my advising based on this at this time. I don't think we have the data to support changing our advising right now. The thing that sort of balances out potentially the increased applications we're seeing from students is that programs are doing increased interviews. So the concern would be that if students are putting out more applications, that means those top tier students are potentially getting all the interviews, and those middle and maybe even lower tier students are not getting the interviews that they would rightfully get if we were not in a virtual environment, because the top tier students have really cast a wider net than necessary. But to compensate for that, we have heard, and certainly you know, the ADF, the program directors in family medicine across the country, many of them increase their number of interviews, some as much as 50%. And so if they're having more interview slots for the same, hopefully we'll be able to compensate for that. So personally, I haven't changed our advising. We don't have the data to support that yet, but I understand students' anxieties related to that for sure, and try to just, like Tomoko, remind them that we're working through this and that we would never give them advice that we think would not make them successful in the match. So Jen, do you have any thoughts on that?
No, I would say a very similar process, right? There might be specific situations with specific students, but relative, we have generally been using that same guideline.
Yeah, us as well.
Tomoko?
The other thing that I wanted to mention is just that, you know, the concern that the top tier students or more competitive students are going to be taking more of the interview slots. So, you know, that's part of what we talk about to students, that one, you're going to be fatigued after doing too many interviews. So, you know, consider that, but also consider your peers. Like, you don't want to take away opportunities from others. So I think that's something that we mention throughout the season to remind them to be considerate of others.
That's great. Excellent. I'd like to also, and actually we have, on my list of pre-canned questions here includes the question about the second look and how that sort of plays into things. There's been guidance from the Council of Academic Family Medicine to say that really there's equity considerations in addition to pandemic considerations when it comes to this virtual interview process. And we have a lot more to learn. We haven't studied this process enough. And that goes for second looks as well. I think it's this really challenging balance for programs, right? They want to give students not only the opportunity to meet them in person, these students are committing to 3 years of their life, or 4 in some cases, living somewhere that they maybe have never lived before. And that's really hard. So a second look, sort of giving them the opportunity to say, hey, this is what our hospital looks like, this is where our residents live, is really challenging. So, I think that there are going to be some programs that, particularly for local students or maybe anybody, are going to be having some in-person second looks. And quite frankly, I think that there's more to be seen with this Delta variant to see if it even is safe for these students to be doing that. It could impact their return to rotation. But historically, I will say participation in second looks has been something we've encouraged our students to do, or to RSVP to a program that they can't make it to because they're on ICU, or they just can't take any more days off because they've interviewed so many places. But a second look is another opportunity to meet more faculty, to meet other residents, to really truly get a second look at a program that's outside of the interview day. So Angie, is that something that you've talked to your students about as far as second looks?
Yeah, and I think we encourage them to participate those if they can, but don't overemphasize it. If it's something that's not possible for them, that it can help solidify a program's interest in you, but it isn't everything. And sometimes those other communications, if they seem appropriate with the program, can be just not the extra pressure, but encourage them. And fortunately, especially for family medicine, most of our students are interested in matching locally, where we have quite a few family practice programs within the metropolitan area of Indianapolis. And in Indiana, you don't have to go too far, like a few hours north or south, to get to some of these other programs. So it isn't super cumbersome for them to make those efforts if it is an in-person opportunity, but just not overemphasizing it so they feel like they absolutely have to do that.
Other thoughts about second looks?
I do have concerns about equity. I think that is my main concern, where I try not to actually encourage students to go, because I know that some students are just not able to, whether it be for safety reasons or financial reasons or time issues. So, and I think that hopefully programs are also considering that and not prioritizing students who make that, who do decide to take that opportunity. But I could easily see that there could be bias against students who are not there. So, I don't think that we have a standardized policy. It did come up at a School of Medicine advising meeting across specialties. And I think that the overall consensus is not to encourage students to go. But I also, here I keep everybody's different sort of opinions on this and sort of advice. Like, I also realize that maybe if I tell students that they shouldn't go, they will be disadvantaged compared to other students at other schools. So, I really don't know what the right answer is here.
Yeah, and I think we have more information to learn about what second looks are and what they look like in this kind of pandemic environment, and sort of what this virtual conversations look like. And I agree with you on the equity piece. And certainly my advice on second looks is sort of old advice too, sort of looking at this through a new lens. We'll have to see sort of how things go. I see another hand up. Jake, do you want to join in on the conversation with us today? Thought I saw a hand. Maybe I didn't see. Oh, there we are.
Hey, thank you. Can you hear me now?
Yes, we can.
Fantastic. So I thought the COPA group had advised against second looks until after programs had submitted rank lists. Could someone fact check me on that? That'd be lovely.
So the short answer is the recommendation has come out, and I will post a link to the PDF of this in the chat. But yes, the recommendations have been to avoid a hybrid interview model and to keep things virtual. I think the issue is that we don't know how many programs will be following that because it's not a match violation for them to not do it. And so I think there's still some things to be learned about it. And some anecdotal data from the AFP has suggested that potentially students even last year, would have been very interested in in-person interactions with programs if they were given that opportunity. So even pre-vaccine, there was a strong interest from students to meet with programs. So I think more to come on that, Jake, but certainly yes, the recommendations that I just posted do suggest that we should be keeping these things virtual until we have more data.
Thank you.
Sure, thanks for joining in. So sort of thinking about this, many of you have talked about the individual sort of advising experience, particularly when it comes to number of programs and thinking through what that looks like. How do you advise students in general when they kind of show up at your door or they're at an FMIG event and they say, how do I become a successful candidate? What makes a strong candidate in family medicine? So Melissa, you guys start early, you start collecting data about your students really early in first and second years. How do you help them become a strong family medicine candidate?
Yeah, that's a great question. I think we talk a lot about, well, first you want to make sure that they're the right fit for them and that they're going to be happy in family medicine and in primary care or in a specialty off of family medicine. And so making sure that it kind of aligns with their goals and their wants and what their practice should look like down the road. And then I think the things that probably most people want in residents are that dependability, people that are, that you want in the trenches with you or that you want on a night of call and that you trust. So being trustworthy, being dependable, being compassionate and caring for your patients, making sure that those values that we all hold so dear in family medicine are things that truly align with how they want to practice. So I think that those are kind of the things that we work with them on, is figuring out, is family medicine going to be a good fit for them, and are they going to be a good fit for us?
Excellent, thanks. Tomoko, when you talk to students through this, what are some of the things you guys talk about?
I agree with Melissa that I think the first step is to listen to the student and what their future direction is going to be, and trying to figure out what their interests and passions are. And I think that should really drive, what specialty they go into, and even within family medicine, to identify the programs that are right for them. I think for family medicine, fortunately, many programs, there's so many, and there's a lot of variety in what each offers. And I think that, there's a more holistic, I think, approach to applicants as well, where, I think that competitiveness is defined a little bit differently. I think one of the most important things that make you competitive is to find the programs that are right for you. So, some of the work has to go into like finding, first knowing what you want so you can find the right programs for you. And then I think, then we talk about like how do you sort of share your passions? How do you communicate that it's going to be a good mission fit for you? And I think that, for example, if a student wants to do rural medicine and be in a very more smaller town or more remote location than an urban center, it doesn't matter like how good your grades are. That's probably not a great fit for you to learn what you want to learn to provide for that type of community in the future. So, and vice versa, if you are super academic and you go to a rural community program, that's probably, you're not going to be competitive even because it's not a good fit. So I think that some of the work really goes into self-reflection, and then we sort of look at programs together.
I really love that piece, because I think if we're talking about earlier or pre-application, right, a lot of it starts with mentorship and thinking about who you've seen in these roles. And I think that helps you decide kind of where your path might live in family medicine. I think you have to see someone in academic family medicine to kind of have some sense of that might be a space for you. And if you should down the line be applying to some of those larger academic programs, or you need to see your rural family doc kind of doing it all and know if that's the experience that you're really looking for, so that you can sort of cultivate a list that's really reflective of your values and sort of how your mission aligns with their programs. So I think it really starts early with getting some mentorship, feeling it out, understanding where you fit in.
That's great. Angie, do you have anything else you want to add about that question?
Sure. And, I'm fortunate that we kind of recruit for students that at least have an initial interest in primary care and family med. And I think the hardest thing for me is helping them figure out between like pediatrics or internal medicine and family med, which is usually in even OB, like, okay, do you like to do surgery? No? Well, then maybe family med your way. Or peds, do you absolutely never want to take care of an older individual? I kind of like older individuals too. Well, maybe you want to think about family med. So, and sometimes they are pretty set on, no, I don't want to take care of diabetes and hypertension, although they don't realize that sometimes kids in some circumstances get those as well. So just helping them think through that. And then I encourage them, I just had my new batch of first years to get involved with something like the Family Practice Club from the very beginning. They'll get a broad experience of procedural type workshops and kind of see the variety that's in family med and set themselves up for if they make a shift later on, whether it be because they've hit a wall or because they had a change of heart. We all have people in SOAP that are all of a sudden thinking about family med. What have they done over the past 4 years to show their openness to full spectrum patient care? And if they can kind of build a resume that kind of shows that, I think that can be helpful. And not everybody that's in the family, even my 4 officers I had a few years ago, only one's going into family med. They're all wonderful students, but some are doing some other primary care specialties. But I think they set themselves up well, getting involved early and kind of discerning that family med pathway so they can show that they've given thought to it down the road and not try to backtrack to show that they're interested at the last minute. And I think it's a good strategy.
Yeah, I think all of these things make sense, and certainly early exposure, early mentorship, giving them some opportunities to explore what their career looks like so that they can follow their passions and find the fit. And, I think, Tomoko, I agree with Jen. What you said was really beautiful, just sort of thinking you're competitive for a program that you're the right fit for. And so how do you find what that fit is? And then how do you show that that's a program that you could be really committed to and really happy in and succeed in? And so, when we think about, and then on the other side of this, we think about what are program directors looking for? Melissa, you said all of those characteristics, right? So teamwork and dedication and, hardworking and steadfast and all of those things. It's interesting. Not one of us said like someone who scored 260 on STEP, right? And so I think it's important to have those conversations with students because the chatter is not about what we're talking about. The chatter amongst students is scarier and is numbers driven, and they're talking to their friends again who are going into other specialties, and that's not the same for family medicine. And so in other specialties, maybe the academic programs are competitive and the community programs are the less competitive. Well, in family medicine, some of the most competitive programs in this country are community-based education experiences and community-based residencies that are fantastic and turn out awesome family docs who do amazing things because they're the most competitive. So it's really this new frame of reference, things that, I agree with all of you that students should be driving at experiences that are passionate to them, and that passion will come through. And that makes them a really excellent candidate. So that's some of the things we talk about. It's not number of publications and it's not, how many leadership experiences you had, but a variety of those things that really is helpful. And when you look at data from program directors, so there's a program director survey published in 2015 in family medicine that was really talked about the number, top things that family medicine program directors cared about was commitment to the specialty. So they cared about the fact that this was a good fit as a specialty. And then, those other elements really came after that. So that was a really important thing for family medicine in general, which is really important. So I wanted to, excellent.
So this is just what you were talking about right now. I think with the survey with the different percentages and then this perceived commitment to specialty by program directors was the highest. So sorry, I just wanted to
No, this is great. And actually that's, that's even newer data coming from 2020. So I appreciate you sharing it. Thank you. So I see we have another question. So David, if you'd like to join the conversation. See if we can't hear you. I don't know if.
Can you hear me okay?
We can, yes.
Hey. What wisdom can you share about assisting students who are dual track or triple track applicants? And they oftentimes fit into that category of students who perhaps are anxious about making a long-term decision, but also perhaps lack self-reflection and insight. So I'd be interested to hear your words of wisdom.
So Angie, I'm gonna put that one to you first. And the reason is because you talked about your opportunity that, what your school has done to support students through the SOAP. So I'm gonna let you start with that one if you have any answer.
Yeah. Yep. And I have students that are applying in every specialty, students I've known since first year of medical school, and kind of followed their up and downs of interest. And I think that's the hardest thing is depending on the two things that they're looking at, right? I think it's pretty easy to make the jump between family med and IM and making a case for that. And I think that, and even with peds, if you want to put that in there too, but I think that we really caution them and try to work with them carefully to help them know how to best interview in those situations, because I think that it can be challenging sometimes when they go into interviews to show that passion for both specialties at the same time. Some choose to kind of be more transparent about it, which I'm not going to discourage a student from trying to be their authentic self about what their goals are in medicine. And sometimes that might pay off for them, but I think that's the biggest challenge. And I think working with them on doing practice interview questions, helping coach them through how to most eloquently answer those type of topics, and also looking at their personal statements. And sometimes if I read both their personal statements, I can clearly see where their heart is in the path that they want to go on. And I'll kind of push them a little bit on that. Ultimately, it's their decision. And I recently even had a student between anesthesia and family med, and she's going family med. And I tried very hard not to, push her, but it was very clear from everything she was telling me. But she had a lot of misconceptions about what her life in family med would be like compared to a specialty. And so I think that can be the most challenge. But we obviously, in some of our students, encourage them to apply to something that's more reachable when they're going for a reach specialty, just so they're not having to do the SOAP process to try to attain those if they're willing to look like ortho to sports med to family med. Sometimes students who can't get into ortho will be just happy doing family med and sports med. And there's a little bit less of a reach for that as far as trying to figure out how to interview well. But no specific answers for you right now about what the best things to say are, but we do work with them closely and help them navigate that challenge of being authentic in both of those processes.
Thank you. Melissa, do you want to add to that one?
Yeah, I think what Angie said about using the personal statements as a gauge it's so beautiful. And because there have been a couple of folks that I've worked with, and you read their personal statements and you're like, I know exactly what you should be doing, even if you don't. So I think you can leverage that to try and see if you can coax out some of their insight. So that can be really helpful. I had someone who went into OB, and then we were working with the following year when they did not match, and trying to figure out if family medicine was going to be the right thing. And then it really turned out that surgery was just not going to be something that they would be happy losing in their career. Even in their family medicine personal statement, I was like, this is not going to be where your passion is. And so that was, I think, just a really listening to that personal statement is helpful. I think if you can also partner with the advisors if at your program you advisors and the other specialties, because sometimes they'll know the students quite well as well. And so sometimes we'll do group sessions or even just meeting by email or phone with the other advisors and getting an idea of what their knowledge is of the student, because sometimes you'll get a different picture than they will, because they are presenting kind of a different half of themselves to that other person. And so you can kind of both put your heads together and see how you can best put the puzzle together and maybe help them to develop some of that insight over time, although not an easy answer or an easy thing to do, but that would be the other thing I'd add.
Yeah, I think the dual application has a lot of opportunities for students and for programs, and then it also has a lot of challenges. And I think there's, David, you said something really clear. There's a lot of different students that decide to apply to 2 specialties. Is it the student, like Angie mentioned, that really is, would be very happy doing all sorts of musculoskeletal care and would be happy as a sports med doc, but is also going to apply ortho? Or is it a student who is really struggling to decide between family medicine and say med peds, for example, and they're going to use the interview process to figure that out, and helping them sort of build 2 parallel applications and actually use the interview process for what it's designed to do, which is find the best fit for them. Those are students that tend to be pretty savvy, and we can work with them and help guide them. But also I have seen that a lot in my career in Albany, because our 4th year, quite frankly, it just starts too darn late. And so our students are really still doing a lot of career exploration. Yeah, maybe they've decided surgery or not, but they haven't had the opportunity with the way our curriculum is currently to really explore that. And so sometimes it is bleeding into that 4th year that really they're starting to do it. I will say, for over the years, the students that think they're going to dual apply, the numbers that actually do by the time it comes time to submit to ERAS is also lower, because you're doing things like reviewing the personal statement of both. You're looking at, letters of recommendation. They've had an opportunity to do at least a couple months worth of electives, and sometimes that can be helpful. But somewhat embracing those students who would be very happy doing family medicine and make excellent family physicians, but are maybe thinking something else and using it as a parallel plan. Helping them get a position that they would be happy with through the match is a much cleaner and nicer and gentler thing than them finding a spot through the SOAP, which is a whole other animal for those of you who have been involved. Tomoko, anything else to add sort of for those students?
Yeah, I think the students that are most challenging for me are those who were referred by other specialties and sort of forced to dual apply because they're not competitive in the field that they desire. So, and I think some of them have not processed that sort of like semi-rejection from that specialty and are not really interested in family medicine or have not accepted that as part of their future plan. So I think that, there is a little bit of harm, I think, to our specialty to have students who don't want to do family medicine to enter family medicine. So I think that identifying those students early and helping them to kind of see a path forward that still they can find satisfaction and happiness genuinely, through a career in family medicine is really important. And I think that if that's actually really genuine and it's self-driven, that they want to do family medicine and can pursue it happily, then I think that can come through their personal, it will start coming through, like the way that they can present themselves through their personal statement and interview process. But if it's not, then I think that is also pretty evident. And even if they're competitive otherwise for family medicine, I think that still puts them at risk. Or they haven't put the effort into their parallel plan of family medicine when they are sort of chasing this other specialty way too hard. So I think that those are the students that I think need extra support, but actually sometimes are not in the position mentally, emotionally to receive it. And I think then, working with the other specialty advisor is really important.
Yeah, I think you said something there, Tomoko, that's really important. And Melissa, I think you were alluding to it as well with your example of a student who doesn't truly want to do family medicine. As undergraduate med ed advisors, I think it's our job to not put our program director colleagues in the position to accept those students who are then going to leave as best we can predict, right? So nobody wants attrition, and nobody wants family docs who aren't excited about being family docs. So even though we have room in our specialty to grow by recruiting more students, I think there's opportunity there to really guide those students who are not accepting of family medicine as a career path for them to find a different route. after graduation, et cetera. So we have just a few minutes left. And so a couple of things I would like to talk about. One of them is there was a comment in the chat that mentions that, Jake Pernuski is in Wisconsin, and he's in a shorter program. And so they're starting to match after their M2 year. And so obviously advising is key, but management of anxiety is also extremely important. And Angie, you said something prior to our panel this evening about sort of the emotional support that you provide to students. And I think I don't want to overlook that. We've talked a lot about logistics and spreadsheets and graphs and some of those things that can help our students, but we've talked a lot about mentorship. But are there specific things that you all are doing to emotionally support your students through this process? And Angie, I'll put that to you first, since you're the one who brought it up earlier.
And I think the thing that's helped me the most over the past couple of years is that longitudinal relationship, that I can really speak kind of truth to them, but also in a compassionate way. And I'm kind of that person with the candy and the little notes in my office and stuff anyway. So, but I have some really challenging students this season that I want to believe that they're going to get what they want, but trying to just take it one step at a time and build that relationship even further, so they know that I'm in their corner, but start kind of getting them thinking about what ifs. And I think that can be really helpful. Now, the first year I did this, I didn't know the class very well. I wasn't teaching full time and came into the situation where I never had these fourth years as first and second, third years. But I just kept building this relationship with someone who probably could have matched ortho, but did not. But he called me immediately, and we had built just enough a relationship that week was a whirlwind, and a lot happens in that week. It's amazing how much they'll open up to you at some point towards the end, and trying just to help them see the forest through the trees and understand that, we got to have a preparedness plan. It doesn't mean I don't believe in you, because I think the minute you start talking about you're not going to match in your specialty that you want or where you want, and they have autonomy. And I think that's kind of my closing thought, is that I personally, I really try to respect their autonomy and give them all the information and walk with them and give them the perspective that I have. But just help them make, they're adults, they have to make their own decision in the end, and try to support them in that and give them the most resources and be there. But I think our match process, where we're there with them continuously for that week, for as much as they want to be in that building, has been very helpful. And their significant others can come in and spend time with them, and we have food and all kinds of stuff. So I think that just being there for them is helpful.
That's great. Yeah. So again, with just a few minutes left, does anybody have any other closing thoughts? So, Jen, anything else that you want to make sure you share with the group?
I guess I would just second those thoughts regarding, Jake mentions managing anxiety. And I think what I heard a lot of what Angie say is there's this piece of accessibility, right? Especially around the match process and around ARIS, is just being accessible. We do a lot of messaging and opportunities for students to ask us questions. I think that longitudinal relationship is really important. And you think about mentorship being one of the big pieces there, and having someone that you can always go to. And ideally, your mentor is someone who will tell you, who is an advocate for family medicine, but will also kind of tell you when you've talked about surgery this whole time, right? And who's really just going to be in your corner. And so we really try to get our students connected with mentors and really sort of be accessible, so that it allays those sort of fears around anxieties. It kind of makes sure they know that we're available if they have questions and they can get them answered.
Great, thank you. Melissa, anything else you want to add?
I don't really have anything different. I think just echoing what both of them are saying in terms of, I think the direct words that really stuck with me were the walking with them, and anything that's difficult. I think having somebody that walks with you, that is a source for information, but a source for support. I remember going through, and you had one advisor that maybe didn't know anything about the field at all, and so you're kind of left in the dark. So being in a place where you have folks that know the specialty and can give you good recommendations and advice, but then also allows you to kind of make your own decisions and looks at you as your own person. I think those are huge strengths and allow people to make reasonable decisions. And then you can be there to support them when things go as well as you hope they do, or if they don't go well, you're the person that they can kind of go to with with other needs if those needs hopefully don't arise, but if they do. So I would just echo that longitudinal relationship, that walking with them piece is just so important.
Excellent. Tomoko, any parting words?
No, thank you for this opportunity. It's been really nice for me to also speak to and hear and learn from you all. I think it's been a rough couple of years being an advisor as well. So I'm really thankful to have a venue where I can hear about, the struggles and victories of other programs as well.
Great. Yeah, me too. I feel like I've learned a lot from this. Emily is posting in the chat some resources that have been gathered from STFM and also the AAFP. And I just want to thank you all for being here and for joining with us and for doing this, as I've put earlier, this sort of just-in-time advising discussion. We know that EURES, programs can start downloading next week. So students are eagerly getting their applications tidied up. And so if you have any questions, if any resources that could be helpful for you as an advisor to medical students, please let us know. There's lots of information in the chat. And also thank you for being here. This recording will be emailed out to all registrants, but this will also be available on the STFM and I think the AAFP advisor resources space. So thank you again, everyone. And thank you to our panelists. You guys were wonderful. And everyone have a wonderful rest of the night. Thank you for being here.